this morning. Now, the term social prescribing means, and I'm quoting here, connecting people to community-based activities to benefit their well-being. The Christian think tank Theos, who gave me that definition, has produced a report arguing that the NHS could rely more on faith groups to do that. We'll hear from the report's author in a moment or two, but first, here's our own Linda Walker with an example of the kind of programme the report explores.
I think what's quite striking, which I don't think you're going to see in many churches, and I don't even know if I should say this because I don't think it'll be popular in many Christian communities, but it's a needle exchange. We're treating hepatitis C, so why not try to avoid it in the first place?
This is Pastor Mick Fleming, the driving force behind Church on the Street here in Burnley. Together with his colleague, Partnerships Manager Nicola Leverett, Mick is bringing important medical and social care services into the church, as well as the chance to just come together with others to chat.
If you look right there, right next to it, that's the Exodus project that me and Pastor Emma wrote, and he's leading people to sobriety. So that's one end of it. This is the other end. Yeah, we'll take you through into so this is like the hub of the church. These are trouble. So see that lady in the corner there with the glasses on and the white hair? We call her the General. The thought is that I'm in charge of the church. Not true. She's in charge of the church.
The Exodus project, which Mick mentioned, is based upon 12 biblical foundations for recovery, sourced from Matthew 5-7, the Sermon on the Mount. As Mick and Nicola showed me around the hub, I had a chance to hear what a difference this programme has the potential to make.
Some churches you walk into and it's all pews and benches and it's very rigid, isn't it? But whilst we are a church, having this space, you do feel like you're walking into like a hub, don't you? A community hub. So it is a church, but it is community. It's everything about what community is to me, really.
Zoe, just walk through the door with you.
Linda, hello. Since Exodus, I've been volunteering in the office. Before Exodus, I needed a mental health support worker to go with me everywhere I went, even to Asda, because I had meltdowns. I was badly into drugs, alcohol. I was homeless on and off, mental hospitals. I was in 7 different mental hospitals. Through Exodus, I feel like I've changed completely. I'm now able to get employment, to help other people with mental health problems and volunteer here.
What do you think the NHS what benefit could they have, do you think, from working better with places like this?
The proof is in people like me. They could maybe help refer people to the Exodus projects that they come across, when they're working. Maybe a community psychiatric nurse might have a client that really could do with this support here, that come find out more about it and then refer people. And I'm so fortunate and grateful to have done it. It's changed my life. I have contact with my children now, with my sister. I have frequent family gatherings I can go to, whereas before I was too ill to have any contact with them.
As well as being a church with a large gathering space, the building also houses bespoke treatment rooms.
During the week we would have lots of members of the public here. Partnerships sit around the side and we have the signs for them, so then people know what services are in that day for each different service that comes in.
During a tour of the church, Mick and Nicola showed me the offices where applications are made for funding, and we spoke more about the work which goes on here at Church on the Street.
We've had to battle against the systems. We've had to battle, screaming and kicking sometimes, to get the NHS to come in here. It's all wonderful now, but trust me, it wasn't. It's been a battle. They wouldn't come in unless we had an NHS standard facility. So we had to find the money to build it. And it cost a lot of money just to make a small room into a clinic.
How much money did you have to find to do that?
I think it was about 20 grand, roughly.
You've expanded what you offer here hugely, partly down to your own fundraising. here at the church?
Not partly, wholly. Really down to our own fundraising. We have had some small grants, but on the whole it's all down to funds that come in from the general public. So for me, when you look at the report, and I've seen it's been backed, government backed, and then you look at how we fill these gaps up and negotiate these systems, we must be saving millions of the NHS for accident and emergency, for the mental health, even the police. It's an astronomical amount of money that we save. From a Christian's perspective or a theological perspective, we're driven by the change. So if somebody said to me, show me your faith, I'd just say, well, just come down here because this is what it looks like. I think if the government think, right, this is a good thing, this can be in 1 million different churches across the country and it's going to save us a fortune, I don't think it can be. I think there's a theological question. What we do here wouldn't fit in every church. In some churches, there's a barrier already there by the nature of what the building looks like, by the nature of the thought process of people's upbringings and everything else. And what we do is we take that barrier out of the way, but we don't compromise our faith.
That report from Linda Walker. The Health Secretary, Wes Streeting, has given his backing to the Theos report. Earlier I spoke to its author, Dr. Marianne Rosario, and I put it to her that many places of worship do this kind of work as it is.
So we're arguing in this report that faith groups and churches offer these services already, but actually building a relationship better between faith and health can have a really transformative impact on social prescribing. We found that faith groups act as anchors of the community. They're well networked amongst the community. They offer buildings and volunteers. They offer pastoral and spiritual care. And actually, if this gets better integrated into the healthcare, this can revolutionize social prescribing. And we know that the Health Secretary, Wes Streeting, really kind of wants to turn the NHS into a neighbourhood health service. And social prescribing can be an essential part of that. And in that, faith groups can play a really, really key role.
Well, just take me through what actually happens. I go to my GP with a problem. How do I go from that to being in a church, if you like?
The NHS have employed what they call link workers. So you go to your GP because you're lonely, for example. Okay. Your GP realizes that it's not a medical reason, or in addition to medical reasons, perhaps, they link you to that link worker. That link worker forms a relationship with you and suggests community-based activities that might benefit you, some of which will be faith-based activities. Like I said, it could be coming to a cafe or exercise classes or choirs or something like that. So it's all about kind of that relationship building between the link worker and the patient to see what's best for them, for their well-being, and then also a relationship being built between that link worker and community-based activities, including faith-based activities.
Isn't there a problem there, though? Because if the polls are right, the likelihood is I'm probably an atheist, as we know. For the first time, the number of people declaring themselves to be Christians has fallen below 50%. I might not want to be sent off to church very much.
Absolutely. And if that's the case, then there should be no pressure, or there should be no reason why, you should be. It's all about forming that relationship to know what's best for the patient. So the link worker is there to kind of understand your needs, to understand what may best suit you or what may not. I went to visit lots of different places around the country doing this research, and actually one was a church based in West London. And I spoke to people there, patients that had been referred there, of all faiths, of no faiths. And I said to them, this is a Christian church, and obviously there's a cross on the wall. Is that okay? And all of them were completely fine by it. And actually one woman who kind of stuck out to me said, if this church wasn't here providing this food bank, I would have no food today.
You are a Christian group, and some people might look at this and say what you're actually trying to do is force Christianity back into the social fabric of the country, if you like, when most people are withdrawing from it.
What I'd say is that actually all these activities that I mentioned, the mums and tots groups, bereavement, cafes, exercise groups, food banks, etc., they're already happening in the country. In the report, we're sort of simply highlighting what's already there and saying, actually, if it's better connected to health, the well-being of individuals could be improved. We know 1 in 5 GP appointments are not for medical reasons, but rather requests for help with issues like loneliness or housing or debt. So if social prescribing and faith and health kind of working together across all the faith groups, the well-being of individuals could be improved. And actually, yes, from a Christian perspective, it's about loving your neighbour, but actually all of the faiths have some element of helping those in the community. And that's what's really important.
Marianne Rosario talking to me earlier.